Well, welcome. It's Thursday, the 12th of March. Now, of course, the news about the spread of the COVID-19 infection that most people are calling the coronavirus is out of date as soon as you broadcast it. For example, the Southern Ireland has just announced closure of schools from tomorrow. I'm become a bit more concerned about Spain in the last half hour or so. There seems to be a great increase in cases in Spain. India, a country I've been worried about for some time. 1.2, 1.3 billion people there. Many living close together, often in poor conditions. The potential for spread there is unimaginable, but is probably going to happen. But pleased to see that Indians have basically closed the country to all tourists at this period of time, cancelling nearly all tourist visas. Hopefully they can really get the curve flattened out in India so it becomes more manageable. But a few things that have caught my attention from the news, and hopefully they'll teach us a few things about what's going on and how to move forward with this virus, really. So the United States, cases continue to climb. Washington State seems to be a bit of an epicenter, 370 confirmed cases there. And the governor's been on TV announcing mandatory social distancing. But I can't say I was overly impressed with the measure that he announced. He talked about meetings of over 250 should be banned, but meetings of less than that can go ahead with correct precautions. It was my impression. But what the governor of Washington State did say is they don't want 60,000 cases by mid-May with 2,000 deaths. So glad to see some more assertive measures are being taken there in Washington State. Basketball. As far as I can see, all the crowds going to basketball is cancelled. Now, the problem here is, if these things are televised, then people often go into crowded areas to watch sport communally, together in groups, because it's much more fun in groups. But it could be more dangerous being in a confined space, in a pub or a restaurant or something, for example, than it could be actually being at the game. So watch your sports by all means, but do it from home, not in crowded public areas. I'm sure you've seen President Trump on TV. All travel from Europe suspended from midnight. Actually, it's from the Schengen zone countries. So in Europe, they have this group of countries called the Schengen zone, where there's basically free travel. I wonder if they're reconsidering whether that's a good idea or not now. But that is the zone that is banned people travelling from. There's still going to be freight transport. And I think Americans are still going to be allowed to fly home. This applies to European nationals from the Schengen zone. San Diego, I got an email yesterday to say the university's moved to classes online. Many places have in the States now. Many educational institutions have. Yesterday we criticised Chicago for the St Patrick's Day celebration going ahead. Delighted to see that's been cancelled. Hopefully other ones have been cancelled as well. Nancy Pelosi has said we've got a public health crisis. John Hopkins has developed an in-house test, which is good. Let's hope that's made available to everyone in the world, and best wishes to Mr. and Mrs. Tom Hanks, as we understand they're infected in Australia. But basically the impression from the United States is things are starting to happen there, which is good. Now, the United Kingdom confirmed cases go on rising. Now, we keep talking about everyone having to play the part. So this is a surgeon from Liverpool. Upon returning, he didn't self-isolate. I think he'd been to Italy. Didn't self-isolate. Went to work. Proceeded to operate on patients and mix with his colleagues. I don't think you need any further comment from me on that. I didn't watch it, but as far as I know, this football match went ahead last night. So people travelling from Madrid, from Spain. This just seems madness to me. Start of the UK peak of coronavirus epidemic is expected within the next fortnight. So we're expecting this to really kick off over the next fortnight. And my country has done 27,000 tests, which is good, and 10,000 per day tests are anticipated, which is good. Now, Iran, that's 10,000 now. I said this is always out of date, 10,000 now. Tests from the World Health Organization. Basically, in Iran, they're short of everything. And this is going to be the case in many countries where healthcare provision is challenged. Still no official travel ban. 10,000 shrines, up to 10,000 shrines apparently in the country are open, with people still attending shrines. As I mentioned before, I don't think that shrines have any antiviral properties, so I don't think there's any point going to a shrine for healing. Many government officials off sick. Now, just a personal email I got from Gilan. This region's in northern Iran. Someone emailed me from there. I know at least of 4 of my friends and family who have died recently by pneumonia. Of course, bilateral pneumonia is the complication that people are dying from as a result of COVID-19, and there's been 1,000 deaths in that province, indicating that the Iranian figures are still behind the curve. Now, South America, of course, is a concern, but I'm pleased to see that Peru have closed their schools at the first case in the country, so an example of proactivity there, which is what we need. Italy, already I'm getting emails about heartbreaking decisions that doctors have to take about who they treat. Cases and deaths increasing. Now, the initial case in this epidemic had no epidemiological link. So they never found out the first person that they recognised as having the condition had caught it via community transmission. They weren't a case zero as such. And this does indicate that the virus had been spreading via community spread in Italy for some time before it was recognised. And my concern is now this is exactly what's happening in the United States, Europe, other countries in the world. There's already extensive community transmission. We'll know that fairly soon because the cases will start rising via community transmission quickly and dramatically. France has got a lot of new cases. President Macron's cleared his desk, apparently. It's his number one priority. South Korea, more cases. Unfortunately, there's been a new cluster in Seoul. I think it was 90 workers in a call centre. So that's reversed Korea's downward trend. But Korea are still implementing very good control measures, which is encouraging to see. North Korea, the politicians there, the leadership are taking credit for having no cases in the country. I shouldn't really be sarcastic. This is a disaster as far as we know. There's poor levels of nutrition, there's poor health systems. The death rate in North Korea is going to be appalling, and my thoughts go out to the people of North Korea at the moment. Germany is increasing dramatically. We mentioned Spain is increasing dramatically. Now, Qatar in the Middle East, an extra 238 cases, going up to that many, but most of these were in one complex, so they've been quarantined, which of course is the correct thing to do. So hopefully the quarantine measures will work for that isolated cluster there. Now, Saudi Arabia is being quite proactive. Pilgrimage sites closed, Mecca, Medina closed, land borders closed. Many airlines and flights suspended. Saudis aren't allowed to travel to quite a few countries, Africa and other places. Educational establishment closed, mass gatherings stopped, all football behind closed doors, all non-Saudis arriving at airports to have proved that they have been tested. So as far as I know, you can't go into Saudi Arabia now unless you've got a certificate or something, I assume, to prove that you've been negative. And quite dramatic measures in Saudi Arabia that I would expect to be effective and delay the Saudi Arabian curve and flatten the Saudi Arabian curve quite dramatically. All gatherings suspended. I'm not sure where there's a cluster there which has been closed. So Saudi taking really quite proactive measures there, as indeed are Romania. Romania is being fairly proactive. 47 confirmed cases, 12,000 tested. They've banned export of medications. Now, this is good for the Romanian people, but I don't think they produce many medicines in Romania, actually. But we did notice last week that India banned export of medications, which could be a concern because India produces a lot of the world's medicines. Events in Romania are banned. Churches, clubs, it was 1,000, they now ban meetings of over 100. Law enforcement is enforcing the quarantines. Universities are going to be closed. Museums will be closed, are closed. And this is important as well. The Romanians and the Chinese did this. They've staggered the times at which people go to work to avoid crowding on public transport. Because public transport is usually very crowded, and that is a high transmission risk. So they're staggering work times. And of course, as everywhere has to do now, we need to promote working from home as much as possible. So pleased to say that Poland is being quite proactive as well, having looked at Romania, another Eastern European country. Now there's 31 cases in Poland, mostly in major cities, which of course is bad. All schools are closed for 2 weeks, so that's encouraging. All the cinemas, theatres, entertainment venues in Poland closed. Starting to close museums, swimming pools and other areas in Poland. All Polish mosques and Catholic churches, as far as I understand it, services suspended. Universities in these Polish cities being closed down. Now, I've got fairly reliable contact in Poland who've emailed me, and they've got confirmed cases of people returning from Italy, as you would expect. So some of these few cases that they have in Poland have come from contacts from Italy, but they've also had confirmed cases of people returning to Poland from Germany, the UK and Norway. So people returning to Poland, these people that have been positive in Poland have returned from Italy, Germany, the UK and Norway. And to me that indicates there's more community spread. If these Polish people had picked it up there, there's more community spread than we think in Germany, the UK and Norway. So that is an indicator of wider community spread in these countries, meaning that we can expect a lot more cases in Germany, the UK and Norway. This is how we got some of the data in the early days from China, by looking at how travellers were infected. So Italy no longer the primary source of infection in the people that have got it in Poland from travelling abroad. Important message there. Mass events in Poland are cancelled, and their health minister, and I'm not going to attempt to pronounce that, but this is probably the most useful thing I've heard a politician say for a while. This is not a time for fun, holidays and leisure. This is the mistake the Italians made. Now, I think he's been a bit harsh there because Italy, to be fair, was the first country and they didn't know they had community spread. But let's underline this. This is not a time for fun, holidays and leisure. This is a time to unite and fight this virus. And I agree.